pleasure to introduce Dr. Callegan-Poche. So all, for the medical students, all graduating peds and mid-peds residents have to do a grand rounds. And so Dr. Callegan-Poche is going to talk about maternal employment and its effects on children. And I was talking to her and I said there are so many different ways that you could go with this, and so I'm interested to hear what she has to say.
Okay. All right. Can everyone hear me okay? Okay. So maternal employment and its effect on children is what I chose to do today. There was a couple things that influenced my decision. I wanted to do something that we hadn't talked about, something different, and then also, as you can see, I am a mother and I have 2 kids, and so this topic particularly interested me. So I have no relationships with the industry to disclose relevant to the content of the CME activity. I hope you like pictures of really cute kids because there's going to be several of them throughout my slideshow. So our objectives for today, we're going to discuss the public attitudes towards maternal work and what's considered best for children. Then we're going to review the current data regarding maternal employment and child outcomes, and we're really just going to scratch the surface of that. And then we're going to discuss how to apply the results to working medical professionals, so all of us, but as well how we can apply that to our patient population. So I love this quote from Angelina Jolie, and I think it's kind of fitting because we do have Mother's Day coming up as well. Sorry, fathers. Y'all will get y'all turn. But I think if you love what you do and the choice you've made in your life, somehow that drives you forward to enjoy it all, even the chaos, even the exhaustion of it, and even when it seems out of balance, which is kind of what I feel like residency and motherhood is a lot of the time. Okay, so we're first going to talk about some maternal employment statistics. So as you can see, this first chart is from the U.S. Bureau of Labor Statistics, and from 1975 to 2012, we can see that women in the labor force, particularly mothers, has continued to increase. And particularly looking at this pie chart, in 1970, 53% of mothers were working compared to 71% in 2012. So more mothers are in the workplace these days. So the Pew Research Center surveyed 3,341 adult Americans in 2014 about their views on working parents. And so they were asked which statement was closer to their views. Statement 1, that children are better off if a parent stays home to focus on the family, or statement 2, the child was just as well off if their parents worked outside of the home. And as you can see, 60% said that the kids were better off if a parent stayed at home, compared to 35% that said they were just as well when the parents went to work. This is another survey that the Pew Research Center did in April of 2013 of about 1,000 adults, and this looked at mothers versus fathers roles and what the public thought. And so we can see that that for mothers' roles, majority of people, 51%, said that the child is better off if the mother stayed at home. 34% said they were just as well off as if the mother went to work. Compare that to the father's role, 76% said the child was just as well off if the father worked. And then next, they said it depends. 11% said it depends. 8% said that the kids were better off if the father was at home. So we can see the difference between how the public views mother and father roles. This is from that same 2014 study. It just kind of breaks things down by demographic groups. So we see that 65% of men and 55% of women agree that children are better off when a parent stays home to focus on the family. Looking at race, Hispanics were more likely to say that children are better off when a parent stays at home. And then when we look at education, we see that support for working parents increases as educational levels rise, which makes sense because those are parents that are in the workplace more. But, interestingly enough, in no group does the majority say that children are just as well off when their parents work. So these are from that survey in 2013. And so with more women in the workplace, majority of people think it's easier for families to earn enough to live comfortably, but it's harder for marriages to be successful, and it's harder for parents to raise children. When you compare young adults versus adults 30 and older, you can see that the 30 and older age group, more of them think that it's harder for parents to raise children, harder for marriages to be successful, and harder for families to earn enough to live comfortably. And so we can see the different views, based on the different generations. These are just some quotes from some of the articles I read. So this first one, although policy and academic debate has voiced concerns that employment could hamper mothers' capacity to care, less emphasis is given to the benefits generated by mothers' jobs. So by contrast, theories of child mental health often view fathers' employment as beneficial, indeed necessary for children's well-being, and few problematize fathers' capacity to combine work and care. So again, we see the difference between mothers and fathers. This one, maternal labor force participation is still scrutinized and questioned in the popular media, and child outcomes are often placed at the center of these debates out of concern over the consequences of maternal absence from the home. And then finally, as increasing female labor force participation becomes a global trend, a great deal of public and scholarly attention has been paid to the effects of maternal employment on children's well-being around the world. And so we can see there's a lot of opinions, and it is something that's out in the media. This is just how I feel every day. So we're going to take a look at some studies, and again, we're just going to scratch the surface. There is a ton of research, and I really didn't know there was that much research until I actually started doing this. But we're going to quickly go through some studies. First, I want to talk about the Behavioral Problems Index. So if you hear me referring to BPI, a lot of the studies use this as an indicator of child outcomes. So it measures 6 dimensions of behavior: antisocial behavior, anxiousness and depression, headstrongness, hyperactivity, immaturity, and dependency. And the dimensions of the behavior are grouped into either externalizing or internalizing behaviors. And it has been widely used and validated in order to evaluate children's behavior problems. Okay, so the first article we're going to talk about is Employment Patterns of Less Skilled Workers, Links to Children's Behavior and Academic Process. So this was an article by Rucker Johnson and his group, and it was published in Demography in 2012. So it investigated whether and how mothers' employment patterns were associated with child development. The data was obtained from 5 waves of the Women's Employment Survey from 1997 to 2003. And they looked at the links between low-income mothers' employment patterns and the emotional behavior and academic process of their children. It was a sample of 753 single mothers in Michigan. Women were between the ages of 18 and 54. 56% were African American, and 44% were white. Okay, so this table, sorry if it's a little hard to see. So what they looked at whether there was job stability, job instability. They also looked at whether there was full-time work and whether they had fluctuating work hours. So when moms worked and they had a stable job, so there was a statistically significant positive effect or negative association between behavioral problems. So the kids had less behavioral problems. Now, when they controlled for employment, when they had job instability, you can see there's a positive association between the behavioral outcomes. And then when they had fluctuating work hours, there was also a positive association between behavioral outcomes, suggesting that that may affect, both of those may affect behavior problems in kids. This pretty much shows the same thing, that job instability and the fluctuating work hours are related to increase in behavior problems. And so again, you can see there's the fluctuating work hours and job instability, and those were statistically significant. Now, they did a little more looking at things, and so depending on, they wanted to see was the changing jobs voluntary or involuntary, and how did that affect things. And so basically, if parents change jobs by choice, so voluntary jobs, there was, so they had less behavioral outcomes as compared to those who involuntarily change jobs. And so we see that there is a statistically significant effect on behavioral outcomes for those who had involuntary job change, like being fired or laid off. Also, the number of years working with fluctuating schedules, so down here, there's also a positive association with behavioral problems. And then they looked at, so this here is work in jobs that require more cognitive skills. And so what you see is if parents had jobs that required more cognitive skills, there was a negative association with behavior. So the children had less behavioral difficulties compared to if they just had this regular full-time work hours. That's less jobs that require less cognitive skills. You can see that there's a positive association with behavioral problems. So to sum it all up, no significant differences were seen among the race, age, gender, and family structure subgroups, but once they kind of separated all of those groups out, there were small sample sizes, so that is something to keep in mind. But these findings do suggest a detrimental association between behavior and mother's job instability or fluctuating work hours, specifically for those jobs that are don't require as many cognitive skills. Okay, so the next study looked at shift work and child behavioral outcomes, and this was by Han and his group, and it was published in Work, Employment, and Society in 2008. So basically, numerous studies beforehand have shown negative effects of shift work on parents, specifically their psychological, physical, and sociological well-being. If that's the case, you know, it's reasonable to think that could impact how the kids behave. So they obtained data from the National Longitudinal Survey of Youth Child Supplement, which was a large national data set from the U.S. They had 1,985 children. They were born between 1982 and 1991, and it included moms who had ever worked since the time of the child's birth. And they made sure they could be followed to age 10 without any missing data for the outcome variables. They were majority white, 51%, 29% were African American, and 20% were Hispanic. Mothers were 16 to 34 at the time of their child's birth. And again, we're measuring behavior problems with this behavioral problems index. Okay, so this is a little less busy table. So overall, children whose mothers worked non-day shifts had more behavioral problems. So again, we see that positive, statistically significant association with non-day shifts. Overall, children whose mothers worked in either professional or sales occupation, so there was a negative association, so they had less behavior problems than those who worked in, for example, like a cashier or service occupation. If they lived more years in a single mother family, they had more behavior problems. And also, if they were welfare reliant, they had more behavior problems. And that's shown right under there. Both mothers and fathers' non-day shifts were associated with more behavior problems, but that association wasn't statistically significant. And so this table is a little hard to read, but basically what it's showing is that children had more behavior problems when their mother worked non-day shifts for more years and when they met one of these other criteria. So they lived in a single mother family. Their family's average income was at the bottom third of the sample population. Their mother worked in either a cashier or service occupation. Their mothers worked for 35 hours or more per week. Their father also worked non-day shifts for more years, and both parents worked non-day shifts for 34 hours or more per week, sorry. So to sum it up, children in the two-parent families whose mothers and fathers both worked non-day shifts on a full-time basis had the most behavioral problems. But what these results on the previous slide suggest is that family type, family income, mother's occupation, mother's work hours, the patterns of parental shift work and work hours, all of those, make substantial differences between shift work and behavior problems. So do you see what I'm getting at? There's a lot of things that affect children's behavioral outcomes. Okay. So mother's work patterns and children's cognitive achievement. This was evidence from the India Human Development Study. This was an article published in Social Science Research just last year. And so they used data from the India Human Development Survey from 2004 to 2005, which was a survey of 41,554 urban and rural households. So they had direct measurements of reading, writing, and arithmetic skills in children 8 to 11 years old. And they also had parental inputs on the child's education. And they made sure that they had information about the parents, household, and there ended up being a total of 10,043 children belonging to 8,732 households. Okay, so this shows that, so for stay-at-home mothers, self-employed women, women employed outside or women employed in multiple jobs, for both reading and arithmetic scores, we see that children of stay-at-home mothers actually had better reading and arithmetic scores. When they participated in PTA, helped with homework, scores were also better. And then when they had private school and coaching, scores were better. So some of those things you question, but I'll show you why. So this is a little busy, but basically this table is the arithmetic scores, this table is the reading scores. So model 1, this first column, that's the control model. So in the control model, compared to children with stay-at-home mothers, those mothers who had outside employment and those with multiple jobs had lower math scores. So we can see that here. And then for reading, women who were employed outside had lower reading scores. Model 2 looked at maternal employment and education interactions, so looking at mom's education. So what they found was when children of women employed in jobs outside the home, or if they had multiple jobs, they were at a disadvantage only if moms had less than secondary schooling in reading and arithmetic skills. And so we can see how that would be true. Then the children of mothers who had higher education that were employed outside of the home had an advantage in reading and arithmetic. So multiple jobs, higher education, we see there, statistically significant positive outcome. For Model 3, they accounted for socioeconomic status. And so what they saw was that children living in families with higher incomes, better housing, they had better cognitive scores. And that's based on this housing index down here. Sorry if y'all can't see it too well. I know it's small. Model 4 looked at maternal involvement, so that included mainly like PTA involvement with the school and then helping with homework. And so again, we see that there is a strong association between attending the PTA with reading and arithmetic skills. And then finally, private school enrollment and private tutoring. Also, they had positive effects. And you can see that if you go over here, the positive effects. And again, we could see why that would be true. This was not anything they presented in the table, but they did see that presence of younger siblings, particularly under the age of 5, did have a negative effect on arithmetic and reading scores of children, as well as the presence of teenagers. And so that suggested that the more children in the home may affect cognitive scores. And this may be due to time constraints, with mother. Okay, so looking at maternal non-standard work schedules and child cognitive outcomes again. So this is a study published in Child Development in 2005. And again, we already talked about the potential negative effects of non-standard hours on parents. And so this data was obtained from the National Institute of Child Health and Human Development study of early child care. It collected information on newborn children from 10 sites across the country in 1991. The only thing about this study is they did include a lot of disadvantaged groups, mothers under 18, families that lived in dangerous neighborhoods, mothers who didn't speak English, mothers who had known or acknowledged substance abuse problems. And so this sample did tend to have higher incomes and higher maternal employment rates when discarding or leaving out those disadvantaged groups. They did home visits at 1, 6, 15, 24, and 36 months. They did phone interviews every 3 months to check on whether the child was in daycare or in maternal employment status. And then if they were in child care for more than 10 hours per week, then they actually did child care visits at 6, 15, 24, and 36 months as well. The final sample included about 900 children whose mothers had worked in the first 3 years of their child's life and who could be followed longitudinally from birth to 36 months with no missing data. 83% were white, 11% were African American, and 6% were Hispanic. Average maternal age at birth was about 28.2. Maternal education at birth was about 14.4 years, and there was about 52 boys and 48% girls. Now, they used a couple of different outcomes for this. They used the Bailey Mental Development Index at 15 months, the revised Bailey MDI at 24 months, the Bracken School Readiness Scale, and the Raynell Development Language Scales at 36 months. Okay. So when they looked at children whose mothers had worked non-standard hours in the first year and continually thereafter, so this row right here, 4 out of the 5 cognitive outcomes, there was a statistically significant negative effect. Compared with mothers who had worked non-standard hours only in the first year, we can see there was 2 statistically significant outcomes. Now, the only thing about these results in this table is that they didn't control for quality of care that the child got at home or whether they were in a child care setting. So this table does control for that. And so what we actually see is that compared with the results in Table 3, most of the significant coefficients were attenuated or had disappeared. So when we look at not having a non-standard schedule in the first year and having it thereafter, we can see where it was 4 out of 5, we really just have 1 outcome that's now statistically significant. And again, here everything's kind of attenuated. What we did see also was that center-based child care was significantly and positively associated with child's later cognitive outcomes. And so, again, positive associations in 3 out of 5 domains if they had good quality child care. So, summing this article up, so the effects of mothers working non-standard schedules tend to be negative, particularly if they occur in the first year of life, but the association between non-standard work schedules and cognitive outcomes may depend on the type of care that the children do receive. A previous study did reveal that although children whose mothers work standard hours are more likely to be in daycare centers by their 3rd birthday, those who work non-standard hours, they tend to be cared for by fathers, other family members, or some other arrangement. They're not necessarily in child care centers. And I think we probably see that in quite a bit of our patient population. When moms work weird hours, they're normally with family members as opposed to a child care center. And so to the extent that child care centers help prepare kids for school, children may be disadvantaged if they miss out on this opportunity. He decided to wear his daddy's welding cap and be silly. Okay, so this was published in Social Science and Medicine just this year, and it looked at maternal employment and child health in Nepal. So this is more looking at physical health of the kids. So they obtained data from the Chitwan Valley Family Study in Nepal. It included measures of children's health in 2016, information on mothers' labor force participation, data on maternal education, household structures, whether or not there was community resources available. And so they used regression models to estimate the relationship between labor force participation of mothers and child health across the first 5 years of the child's life. There were 860 children born to 793 mothers. And basically this is all the variables, the control variables. So whether or not there was resources, how many kids were in the house, how many people were in the house, how wealthy they were, what their ethnicity was, mom's age, mom's education level, all those sorts of things. So what they saw, so they used, they looked at length, weight, and then middle upper arm circumference as kind of indicators of child health and nutrition assessment, basically. So what they saw was that children whose mothers were currently working, so they had statistically significant smaller middle upper arm circumference than those mothers who were not currently working. But when we separate that out by labor, we can see that wage labor really is the one that has the negative effects. And again, this looks at the timing of employment, and so this is just basically if they've ever worked, if they worked before the child was born, if they worked in the first 1,000 days, the last 12 months. And again, what they really pointed out is that there is this negative association between wage labor. You don't really see statistically significant effects in those who had a salary job or owned their own business. So in this study, mothers' employment was negatively related to child health. Again, this is Nepal, so keep that in mind. Children whose mothers engaged in paid labor had worse health. There was some evidence of a positive income effect in the study. Authors did say that it is possible that the different effects of the employment, it wasn't necessarily due to job type, but more due to the earnings that they received. So wage labor, less earnings, less financially stable, worse outcomes. Also, important to note, children who had working mothers, they were less likely have been exclusively breastfed for the first 6 months, which could also have negative health consequences. Okay. So this study looked at whether children have adapted to their mothers working, and they wanted to look at the relationship between maternal employment and child well-being within the context of birth cohorts. And so, again, they used data from the Children of the National Longitudinal Survey of Youth. It was started in 1986, continues on a biennial schedule, and there are 6,000, or all the children born to 6,283 women of the study. And they, for their cognitive assessments, they used Peabody Individual Achievement Test, reading recognition, and mathematics, and then they used the BPI. Again, this is just the descriptive statistics. We won't really go over that. Okay, so these are the results. Okay, so this first table is reading, and the second table is math scores. And so what we can see is that mothers' hours worked per week in year one, there was actually a positive association with reading scores. And then mothers who had more hours per week currently, again, positive association with reading scores. And we see that same trend for math scores as well. This is for the behavior problems. And so For children whose mothers averaged more hours across the entire observational period, they had lower average behavior problems compared to their counterparts. So before introducing controls, they saw that maternal employment was typically associated with greater well-being, higher reading and math scores, lower behavior problem scores, but after they controlled for a variety of child, mother, and family characteristics, all early and current maternal employment coefficients were reduced to non-significance across all three indicators, with one exception, that maternal employment in the second year after birth had a modest negative effect on children's average reading score trajectories. And so we can see for reading, if we look at hours in year 2, we see that there's a negative association, and again, age and hours per week in year 2, there's a statistically significant association. And so these findings show the largely inconsequential influence that maternal employment has on child outcomes regardless of birth cohort. Okay, I think we have 2 more studies left, and I'll try to get through them quickly. So job equality and inequality, parents' jobs, and children's emotional and behavioral difficulties. This was an article published by Strasdens in Social Science and Medicine, and they wanted to examine whether poor quality jobs posed a risk to parents' children. They defined job quality as those sets of work features which foster the well-being of the worker. They looked at 4 elements: job control, insecurity, flexible work hours, and paid family-related leave. Data was obtained from the Growing Up in Australia longitudinal study in 2004, and children were 4 to 5 years of age, and they also obtained data on their parents. There were 2,373 mothers and 3,026 fathers. They used the Strength and Difficulties questionnaire to assess child health, and they adjusted for a variety of things, including parents' education and age, whether or not there was an infant in the family, whether parents were self-employed, whether the parents had a chronic medical condition, whether the kids had some kind of extra care condition, whether it be behavioral or medical. They controlled for child gender, socioeconomic status, and whether or not they were in child care. So their first hypothesis was that both mothers' and fathers' poor job quality is associated with increased child emotional and behavioral difficulties. And so what we see, we're going to mainly be looking at job quality, and we're going to mainly be looking at these last columns. So for job quality, their poor quality jobs were associated with more child difficulties for both mothers and fathers. Now, their second hypothesis was that the association between mothers' job quality and children's difficulties would be stronger in lone than couple parent families. They didn't really see that. There wasn't a statistically significant association in lone mothers, but the sample size was only 230 compared to 2,000 in couple parent families, and so this hypothesis they didn't necessarily see, but it could be due to sample size. Their third hypothesis was compared with economically advantaged families. Low-income parents would be more likely to have poor quality jobs, and their children's difficulties would be more strongly associated with parent job quality. And so again, low-income families, this is for mothers, this is for fathers. So if they have low income, we can see that compared to mid to high income, the association is not as strong. And with dads, there was just a modest change, but it was considered statistically significant. And then their last hypothesis, the association between the quality of parents' jobs and children's difficulties would be mediated by parent mental health or psychological distress. And they expected that once the influence on job quality on parent mental health was accounted for, there would be no direct association between parents' jobs and children's difficulty. And so what they saw is, So looking at job quality, this looked at psychological distress. So more psychological distress, obviously, is associated with poorer job quality. They did look at the difference between mothers and fathers' distress and children's difficulties, and they saw that children's emotional and behavioral difficulties were associated with parental distress, and the association was statistically significantly stronger for mothers compared to fathers. Trampoline here. That's my nieces and my son. Okay. This is another study by Strasdens and his group, and they looked at combining work and family and whether there was rewards or risk for children's mental health. Again, using the the longitudinal growing up in Australia study, same year, same age group of kids. Most parents were middle class. Average age was in the mid to upper 30s. They did note that there was an underrepresentation of employed lone fathers and families who had a child with poor physical or mental health. Again, they adjusted for a variety of variables, and then they used the strength and difficulties questionnaire again. So they looked at work-family facilitation versus work-family conflict. So what they described work-family facilitation as was the rewards and supports that jobs give to parents. Conflict was parents' difficulties managing employment and family care. Okay, so these are the results, and again, it's mothers and fathers, and we'll kind of go back and forth between the hypotheses. So hypothesis 1 was that for employed mothers and fathers, their work-family facilitation would show protective associations with child mental health. Work-family conflict would show detrimental associations with child mental health. So after they adjusted for the various parent, household, and child characteristics, they saw that greater parental work-family conflict were associated with greater child difficulties. So we're mainly going to be looking at this step. And so work-family conflict, more positive association, so more difficulties. Work-family conflict, positive association, so more behavioral difficulties. Now, mother's work-family facilitation had a protective association with child difficulties. So mom's work-family facilitation, negative effect, so less behavioral difficulties. Now, for the fathers, there was not a statistically significant, it wasn't statistically significant for facilitation. Their second hypothesis was that parents' mental health and irritable parenting are key mechanisms that explain the association between work-family facilitation or conflict and children's mental health. And so basically what they did was they looked at psychological distress and irritable parenting, and when that is what they did for step 2. So when we look at that, we see when they account for that and control for that, work-family conflict, there's no longer a statistically significant effect on kids' behavior. For facilitation, it does kind of attenuate it a bit, and it is statistically significant. For fathers, it is statistically significant in regards to work-family conflict. Again, no statistical significance for facilitation. And then hypothesis 3, they thought relatively disadvantaged parents would report less facilitation from employment, and low socioeconomic resources would amplify both the risk to children's mental health from parents' work-family conflict as well as the benefit to children from work-family facilitation. So again, mothers and fathers, and so we can see this kind of dotted line is high socioeconomic status. So high socioeconomic status in general, much lower child difficulties overall, and then we see that for the low and middle socioeconomic position, when fathers and mothers have greater facilitation, there's less childhood difficulties. And so there is a protective effect among low and middle socioeconomic status families. So I know that was a lot, and there's a lot of studies, and like I said, I've barely even scratched the surface. Just to kind of sum up what a lot of them say, many factors contribute to children's cognitive and behavioral development. Low-income, single-parent families may disproportionately work those non-standard hours, experience more job instability, and have fluctuating work hours. Parental job instability does have adverse consequences on children's behavior, academic achievement, and their subsequent adult employment outcomes, particularly, again, in those economically disadvantaged families. But working full-time jobs that require more cognitive skills is not associated with children's behavior problems. Behavior and cognitive outcomes are affected by many other factors, kind of as we alluded to, such as welfare reliance, type of family structure, whether they're single versus dual parent, the presence of parental or child medical condition, resource availability, maternal education, socioeconomic status, parental health, kind of all those factors play in. And then center-based childcare does have a positive effect on cognitive outcomes. So how does this apply to us? So most of us either are parents or planning on become parents, or if not, we certainly see parents in our clinic all the time. So for your own children, know that childcare can be beneficial. I feel guilty about sending my kids to childcare, but it is beneficial. We just have to look out for high-quality childcare. Be involved with your children. Be involved with their school. Help out with homework. Be attentive and caring. Take care of your own mental and physical health, because your health can affect your child's health. And then we are in jobs that require more cognitive skills, which is associated with less behavioral problems, even though we do frequently have non-standard work hours. Now for our patients, a lot of our patients are going to be in this lower socioeconomic background. Younger mothers, they do rely on government assistance. And so we need to be able to provide tips and guidance to them. So if possible, if they are thinking about choosing a childcare, again, recommend that high-quality childcare, somewhere that's going to have structure, that's going to have dedicated learning, things to facilitate school readiness, Head Start, early steps if needed. All of those things are great resources that we have in our community for these kids. Again, encourage activities such as reading at home and engaging with the child. I know we try to do that at a lot of our well child visits. We try to provide books and encourage reading, and so that is really beneficial to the child. We want to make sure and encourage mom to be involved in school activities, be involved in homework, help the child, be attentive and caring again. Make sure moms take care of their own physical and mental health. So make sure we're performing depression screen. Make sure we're asking, if mom seems a little, frazzled, make sure we're asking mom if she's coping well, if she's doing okay. Because sometimes, moms don't go to the doctor if they don't have to. We may be the ones that catch that. For our young mothers, we've seen that maternal education also has an effect. So encourage our young mothers, our teen mothers, encourage them to stay in school. And then provide community resources. We do have community resources. We just had that talk last month about parents as teachers, referring them to that, helping parents learn how to teach their kids, how to interact and engage with their kids, is going to be great for our families. Those are my resources, and that's it. Questions?